Nutrition. Nutritional needs change with age. Let's examine how caregivers should nourish children during the first years of life and some risks to nutrition that they should be aware of. Breastfeeding. Breast milk is considered the ideal diet for newborns. Colostrum, the first breast milk produced during pregnancy and just after birth, has been described as, quote, liquid gold, end quote. It is very rich in nutrients and antibodies. Breast milk changes by the 3rd to 5th day after birth, becoming much thinner but containing just the right amount of fat, sugar, water, and proteins to support overall physical and neurological development. For most babies, breast milk is also easier to digest than formula. Formula-fed infants experience more diarrhea and upset stomachs. The absence of antibodies in formula often results in a higher rate of ear infections and respiratory infections. Children who are breastfed have lower rates of childhood leukemia, asthma, obesity, type 1 and 2 diabetes, and a lower risk of SIDS. The United States Department of Health and Human Services recommends that mothers breastfeed their infants until at least 6 months of age, and that breast milk be used in the diet throughout the first year or 2. Maternal benefits of breastfeeding. Several recent studies have reported that it is not just babies that benefit from breastfeeding. Breastfeeding stimulates contractions in the mother's uterus to help it regain its normal size, and women who breastfeed are more likely to space their pregnancies further apart. Mothers who breastfeed are at lower risk of developing breast cancer, especially among higher risk racial and ethnic groups. Women who breastfeed have lower rates of ovarian cancer, reduced risk for developing type 2 diabetes, and rheumatoid arthritis. In most studies, these benefits have been seen in women who breastfeed longer than 6 months. Challenges to breastfeeding. However, most mothers who breastfeed in the United States stop breastfeeding at about 6 to 8 weeks, often in order to return to work outside the home. Mothers can certainly continue to provide breast milk to their babies by expressing and freezing the milk to be bottle fed at a later time or by being available to their infants at feeding time. However, some mothers find that after the initial encouragement they receive in the hospital to breastfeed, the outside world is less supportive of such efforts. Some workplaces support breastfeeding mothers by providing flexible schedules and welcoming infants, but many do not. In addition, not all women may be able to breastfeed. Women with HIV are routinely discouraged from breastfeeding as the infection may pass to the infant. Similarly, women who are taking certain medications or undergoing radiation treatment may be told not to breastfeed. Cost of breastfeeding. In addition to the nutritional benefits of breastfeeding, breast milk does not have to be purchased. Anyone who has priced formula recently can appreciate this added incentive to breastfeeding. Prices for a year's worth of formula and feeding supplies can cost well over $1,500. But there are also those who challenge the belief that breast milk is free. For breast milk to be completely beneficial for infants, the mother's life choices will ultimately affect the quality of the nutrition an infant will receive. Let's consider the nutritional intake of the mother. Breastfeeding will both limit some food and drink choices, as well as necessitate an increased intake of healthier options. A simple trip down the supermarket aisles will show you that nutritious and healthier options can be more expensive than some of the cheaper, more processed options. A large variety of vegetables and fruits must be consumed, accompanied by the right proportions and amounts of the whole grains, dairy products, and fat food groups. Additionally, it is also encouraged for breastfeeding mothers to take vitamins regularly. That raises the question of how free breastfeeding truly is. A historic look at breastfeeding. The use of wet nurses or lactating women hired to nurse others' infants during the Middle Ages eventually declined, and mothers increasingly breastfed their own infants in the late 1800s. In the early part of the 20th century, breastfeeding began to go through another decline. By the 1950s, it was practiced less frequently as formula began to be viewed as superior to breast milk. In the late 1960s and 1970s, greater emphasis began to be placed on natural childbirth and breastfeeding, and the benefits of breastfeeding were more widely publicized. Gradually, rates of breastfeeding began to climb, particularly among middle-class educated mothers who received the strongest messages to breastfeed. Today, women receive consultation from lactation specialists before being discharged from the hospital to ensure that they are informed of the benefits of breastfeeding and given support and encouragement to get their infants to get used to taking the breast. This does not always happen immediately, and first-time mothers especially can become upset or discouraged. In this case, lactation specialists and nursing staff can encourage the mother to keep trying until baby and mother are comfortable with the feeding. Alternatives to breastfeeding. There are many reasons that mothers struggle to breastfeed or should not breastfeed, including low milk supply, previous breast surgeries, illicit drug use, medications, infectious disease, and inverted nipples. Other mothers choose not to breastfeed. Some reasons for this include lack of personal comfort with nursing, the time commitment of nursing, inadequate or unhealthy diet, and wanting more convenience and flexibility with who and when an infant can be fed. For these mothers and infants, formula is available. Besides breast milk, infant formula is the only other milk product that the medical community considers nutritionally acceptable for infants under the age of 1 year, as opposed to cow's milk, goat's milk, or follow-on formula. It can be used in addition to breastfeeding, supplementing, or as an alternative to breast milk. The most commonly used infant formulas contain purified cow's milk whey and casein as a protein source, a blend of vegetable oils as a fat source, lactose as a carbohydrate source, a vitamin-mineral mix, and other ingredients depending on the manufacturer. In addition, there are infant formulas which use soybeans as a protein source in place of cow's milk, mostly in the United States and Great Britain, and formulas which use protein hydrolyzed into its component amino acids for infants who are allergic to other proteins. One early argument given to promote the practice of breastfeeding was that it promoted bonding and healthy emotional development for infants. However, this does not seem to be the case. Breastfed and bottle-fed infants adjust equally well emotionally. This is good news for mothers who may be unable to breastfeed for a variety of reasons, and for fathers who might feel left out.